All right, let's dive in. Today we're unpacking a type of cancer most people have never, ever heard of. One that doesn't start from a mole or from sun damage, but from a place you'd probably least expect. We are talking about porocarcinoma. I mean, it sounds a little strange, right? When we think of skin cancer, our minds almost always jump to sun exposure, moles, that kind of thing. But our skin is this incredibly complex organ, full of all sorts of structures, including, yeah, sweat glands. And it turns out they can become cancerous too. So, what exactly is porocarcinoma? Well, in the simplest terms, it's a malignant tumor that grows from the acrosyringium, which is really just the fancy medical name for the very top part of a sweat duct, right where it opens up onto your skin. You can almost think of it as the evil, cancerous twin of a much more harmless growth called a poroma. Okay, so how does something this unusual even begin to show itself? Let's take a look at the very first clues, the things a doctor or even a patient might see right there on the surface of the skin. So there's a pretty specific profile here. Get this. While it's technically the most common type of sweat gland cancer, that's kind of like being the tallest person in a room full of very short people. It's still incredibly rare overall. It usually pops up in older patients, typically on the lower legs, head, or neck. And it often just looks like a purplish growth that's kind of pushing its way out from the skin. But this last point, this is the one that really matters. Catching it early is absolutely critical because the outlook gets much, much worse the longer it goes undiagnosed. So once a biopsy is taken, that's when the real detective work begins. We're leaving the world of what the naked eye can see and we're going microscopic. Let's follow a pathologist on their journey, right into the heart of the tumor itself. This image gives us a fantastic sort of under-the-hood look at what a pathologist is seeing. Now, at first glance, it might just look like a chaotic mess of cells, but hidden inside this chaos are 5 telltale signs, 5 really distinct clues that basically scream porcinocarcinoma. Let's go track down each one. So the very first clue is what's called the epidermal connection. You can see right here how the tumor seems physically attached to the epidermis. That's the top layer of our skin. And this makes perfect sense because it tells a story. It confirms that it started in that sweat duct opening, the acrosyringiums, and it's still connected to its roots, so to speak. Next up, pathologists are on the hunt for what's called an infiltrative growth pattern. The best way to think about this is like the roots of a weed in a garden. The tumor isn't some neat, contained little ball. No, it's actively pushing and spreading its way into the healthy tissue around it. That pattern is a classic sign of malignancy. Now for a clue that is just fascinating. If you look really close inside these nests of cancer cells, you'll start to see these tiny, clear circles forming. These are ducts. It's almost as if the tumor remembers what it's supposed to be, a sweat gland, and it's trying and failing to build the very structures it came from. This feature, ductal differentiation, is a dead giveaway for pathologists. Okay, this term sounds super complicated, but the idea behind it is actually pretty straightforward. Comedonecrosis just refers to the presence of dead or necrotic tissue right in the center of these tumor nests. Why does this happen? Well, it happens because the tumor is growing so fast that it literally outgrows its own blood supply, causing the cells right in the middle to die off. It's a hallmark of really aggressive growth. And for the final clue, you have to zoom way, way in and look at the individual cells themselves. You know, healthy cells are generally uniform, kind of like bricks in a wall. But here, you see total chaos. There's a feature called cytologic pleomorphism, which is just a fancy way of saying the cells are all mismatched shapes and sizes. Plus, you see what's called high mitotic activity, which means tons of cells are dividing like crazy. This kind of cellular anarchy is a classic sign of cancer. Okay, so the pathologist has spotted all these key features, but in medicine, you need to be certain. So now we move to the final step in this whole diagnostic quest, using special chemical stains to get definitive proof. And this is such a critical question, right? Other skin cancers, like squamous cell carcinoma, can look a lot like this under the microscope. They can be convincing mimics. So how does a pathologist make that final call and rule everything else out? Well, the answer is in this really powerful technique called immunohistochemistry. It's basically like using special chemical dyes to make specific parts of the cells light up. The whole concept here is just so cool. Different chemical stains act like specific highlighters for certain proteins inside the cells.
So for Porocarcinoma, stains called EMA and CEA will make any of those duct-like structures glow, which is strong evidence that it came from a sweat gland. At the same time, they can use other stains to specifically rule out those other look-alike cancers. It's like a process of elimination, but at the molecular level. Wow, we have covered a lot of ground here, from a strange spot on the skin all the way down to the specific proteins inside a cancer cell. So let's zoom back out for a second and just recap the key steps in this entire diagnostic journey. You can see the whole pathway is a model of modern pathology. It all starts with that clinical suspicion, the unusual growth. Then, a biopsy allows for a microscopic deep dive, where the pathologist hunts for those key structural clues we talked about. And finally, those special stains are used to provide the definitive, molecular-level proof. Let's end by coming back to this really powerful quote. It's such a stark reminder of why this whole detailed process is so incredibly vital. With rare diseases like porocarcinoma, getting an early and, just as important, an accurate diagnosis isn't just a good idea, it can be everything. It really shows that every single step in this diagnostic quest truly, truly matters. And that brings us to our final thought here. This deep dive into porocarcinoma, it isn't just about one rare cancer. It's a perfect example of the incredible medical detective work that's required to diagnose thousands of rare diseases. It highlights the power of pathology to find answers that are hidden in plain sight. And it leaves us with this question. In a world so focused on common ailments, how do we continue to sharpen the tools and maintain the focus needed to solve the riddles of the rare?